So tell us, what's your beef with the way that things have been conducted in India then?
Well, back in March, when there were just about 200 cases, I had predicted that there would be, hundreds of millions of cases, and had said that India needs to respond urgently. In early May, the Indian government had performed a serological survey where you actually test for people who've been exposed to the virus, and found that probably 10 million Indians had been infected by that point already. And at that point, the reported cases was just about 50,000. So India was undercounting infections by a factor of about 200 at that point in time. And if you look at today, you see that there's probably 1 million reported cases, but India continues to be amongst the bottom in the world in terms of tests performed per million population, about 138th on that ranking. So it's quite likely that even with the expansion in testing, India is testing far too little to be able to provide a reliable figure on the actual number of infections, which in my estimate and that of other epidemiologists has already crossed 100 million infections at this point in time. The official number is 1 million, but we're probably picking up 1 in every 100 infections at best.
That's right. So the true number is huge, is what you're suggesting here. But in a country which is so densely populated in places, it's a very, very big ask, is it not? So there's also massive pressure on funding too. So is there a better way of conducting these tests? Is there a better way of actually isolating and perhaps stopping the spread?
First of all, counting cases through testing is not the right way to go. I know many countries are doing this, but we have to be careful that every time we talk about numbers of cases, these are reported cases, whether in the US, the UK, Brazil, or anywhere else, and it's a function of testing. At this point, using this kind of testing to count your cases doesn't make much sense because most people are asymptomatic and probably not at risk to themselves. However, we do need to pick up clusters of cases in places. That is best done through a different method called serological testing, which involves antibody tests, a form of testing that India has not deployed a huge amount of till date, very, very sparingly. And also, the other option is to use pooled RT-PCR, which is take our current testing method, put in 100 samples in there or 50 samples in there and test them at one go. But we have to also count the deaths accurately because every death represents probably 100 underlying cases. And here too, there has been an incentive to underreport deaths, and therefore there's a serious undercounting of deaths in India at this point.
And of course, the poor are hit hardest here, are they not, Ramanan?
They absolutely are. The true inequity of this is that COVID-19 was a disease brought into India by the rich who traveled on planes to other countries. And then this was followed by a lockdown for 2.5, 3 months, and in many ways still continues in many parts of the country. And the disease was effectively transferred to the poor. The rich are able to socially distance, the poor are not. And consequently, the disease is spreading the most amongst the poor, although I should say everyone is affected to some extent, but certainly the poor are disproportionately affected.
This is the really hard part too when you look at so many people living below the poverty line, Ramanan. You're saying India can't afford to have any more lockdowns. So in that sense, is it just going to be a situation where the disease kind of runs rampant across the country?
Unfortunately, that's probably going to be the case because there are lockdowns in various parts of the country at city levels. The lockdowns themselves represent a failure of testing because if you have good testing, you know where the cases are. You don't have to lock down an entire city or state. So the continued, unavailability of testing, or both in terms of access as well as price, makes it very difficult to rely on that as the way in which you control the epidemic. And you're certainly right that India can't afford any more national lockdowns and probably can't afford many state lockdowns either. But this is really the only effective way. It's a very blunt instrument, not terribly effective, but of all options, the only effective method that seems to be available. But since this is not going to be available, it can't be done indefinitely, you're absolutely right. It is a disease that's going to run its course, and India will be quite at the opposite end of a country like New Zealand, for instance. That option was perhaps never available to India, but certainly is not available now.
The other concern is, well, we still don't have a vaccine, but even if we were to get one, how likely is it not only the cost, but getting to the multitude of people in India? You're saying perhaps not by 2022 until that we would see that happen.
Well, realistically, I think there's a huge amount of over-optimism about when a vaccine which is safe and efficacious will be available. We don't want to take shortcuts here because we're vaccinating a huge number of people. In a typical year, there are 26 million children born in India every year, and India manages to vaccinate about 3/4 of them, against childhood diseases for which, there's no argument that they should be vaccinated against these. So when you can't vaccinate 26 million children every year, it's a tall ask to have over 1 billion people vaccinated, and that too in a very short period of time. It's virtually impossible. I'm not saying, I just think it's very unlikely that it can be done in a space of just a few months. Something like that would take, a few years to carry out to vaccinate 1 billion people.
We talked about how the poor are clearly the most vulnerable here, and they are in every country, but there are some countries that have huge quarantine facilities in place. You look at what's happening in Hong Kong, they're ramping it up there, and we have a lot here in Singapore too. Talk us through, I should say, what the healthcare capacity is like at the moment in India, because early on in the pandemic, there were terrible scenes of hospitals, particularly in Mumbai, being overcrowded, people just, in the hallways and the like.
Well, those terrible scenes were repeated in Delhi as well. The south of India tends to have much better facilities than the north, and therefore it wasn't a scene that you saw in Chennai, for instance, also because Tamil Nadu had ramped up to prepare. But now those scenes are being witnessed in Bangalore, a city which had performed quite well until now, also in Pune and also in Ahmedabad. So it's only a matter of time. The virus doesn't attack all cities at the same time. Each of them has their own turn, because every state the date of virus introduction was very different in different states, and also the volume of virus introduction. So I think that's a story that we're going to see repeated in many larger and smaller Indian cities over the next 3 or 4 months. And there seems to be no way to stop that from happening.
Ramanan, I'm sure you look at other countries, and every country is unique, but is there one country in particular which perhaps India should be learning from?
You're absolutely right. India has some very unique challenges which make it unlike any other. And I have to say, the good things that India did do was, unlike Mexico or Brazil, where there was not senior political leadership willing to acknowledge the importance of this virus, that was done very early in India. India's problems reflect a lack of investment in public health over decades. They reflect, governance capacity that's only able to work in a law and order mode to be able to shut down places rather than enforce things like mask wearing or social distancing. So, this is a law and order that can only work at a fourth gear or nothing at all. And that's the price we're paying for that lack of governance. And the last thing is that there's also a lack of education, and people don't understand that this is important or serious at some level. They do sometimes. I've been enthused to see people do wear masks, and even without cop being around. But I think these are unique problems of this density, the size, the lack of public health facilities, the governance challenges, and then also the social capital challenges that India has. That I don't think any other country with these challenges has done particularly well during this pandemic.